All right, so I get to facilitate this next part of Q&A, and I think Steve has brought us actually to exactly the right part, because after hearing those really interesting introductory remarks, I think that the sharp stick that we actually want to poke into this particular panel is how do we change this status quo? I think that Steve talked very articulately about where health leaves the process, and so the question is how to get it back. Why does this break? And let me carefully craft my argument here. So my argument is this. So we'll start in the case of schools and work our way into other things. So I think the one thing we all can agree on is that we're not going to compromise the health of our kids. Great idea. All right, how long is that going to last? All right, so Claire, Lorna, or whoever wants to jump in, where does that, after we get done saying those words, what happens to those words, and why does that not connect to the ground? And where's the most effective point for intervention that you can see at this point?
Well, one of the things that's happened, and that's why I put a copy of the triennial report up there, is that states are actually leading in the area. States are introducing and passing laws on indoor air quality, passing laws on green cleaning in schools, passing laws on integrated pest management and safer pest control. They are doing those things, and they're way ahead in many ways, partially using EPA guidance to build on, and then using advocates from far and wide, and school stakeholder groups, unions, teachers associations, and so forth. So I think states are already taking a leadership position regarding policy. If the question is design, then you've got really, there's give me the best Butler building you can always get, school of thought. And then there is LEAD, which has gone out and done LEAD Silver in Maryland and Ohio, for example, in many districts. And then there's CHIPS, Collaborative for High Performance Schools, chips.net, which is active in, 12, 13, 14 states as voluntary or mandated school design standards. So I think in some ways there are things that are happening. But if you ask the question, if it's an individual existing building and who's getting the message, that's a very different question, and that one's almost impossible to answer. So I'm pass on it.
All right, Lorna.
Well, EPA, although has some participation and suggestions for design in terms of optimizing design, particularly on the energy aspect through Energy Star Target Finder, there are many guidances that we have that talk about operation and maintenance of buildings in order to focus on good air quality. So Claire mentioned the tools for schools. I mean, most buildings are already built. They're already there. So we have to deal with them in a way that keeps the occupants of the building healthy. And even in a LEED circumstance where a building has been built and it owns a certification, the leap from the architect's vision, the construction, and then the pass-off to the owners to say, take care of this baby, raise it well, send it to college, and don't screw it up and let it be deferred maintenance and have an early death. Where's that continuum? I mean, EPA is offering some guidance, but in order even for tools for schools and state policies that are in place, the actual boots on the ground teams, schools like in particular, since I know that best, sorry for hanging there, but schools are very siloed also. So the facilities folks don't talk to the principal, that don't talk to the nurse. If you talk about school health, I always joke that if you talk to about school health to a school nurse, they talk about sex, drugs, and rock and roll. That the idea of environmental health as we've defined it, air quality, cleaning materials, how you use the building, what the lighting is like, the nurse is going to look at you and go like, really? But if the nurse is on a team with others in the school that are concerned about how that building is operating, not only a school, take it to an office building, take it to any other kind of building you have to deal with, then you have more opportunity to think about the health endpoint and all work together in some collaborative way on the same path.
Claire, you're wanting to get back in.
I did, just because this was started originally as a question about measuring and surveillance of buildings in some ways. And one of the things that happens, even though states have taken the lead in some policy areas like indoor air and IPM and things like that, where they have not been leading is how you assess the state of your existing building stock. So some states have looked at public schools, because that's where the public investment goes, as a problem in capital asset management. So we want to record everything that's going on with these buildings so that we can project what they're going to come and ask us for 2 years from now or 3 years from now. But that doesn't really get to environmental health and safety. My organization convened and funded a metrics and surveillance working group. It ran about 20 months, about 19 different organizations. We found, just in this first cut, it was 10 times more complicated than we thought it would be. In this first cut, we found roughly 155 different measures of schools that are used, school buildings specifically that are being used, but none of them are applied in any consistent fashion. So there's no accountability. I mean, what gets measured gets done. And if nobody's measuring it, nobody's going to.
All right, so I'm going to build on that first.
Wait a minute. We have an example of someone who is doing this in a positive manner. I want to know how she does it. How does Dina convince these schools to use HiBR? So I already told Dina I'm picking on her.
Well, for starters, I'm an eternal optimist. So I go into any potential situation with a belief that building trust and building relationships, understanding and having empathy for everybody's needs and desires is a first step to crafting an agenda that, everyone can come to consensus around. Health in schools, since there's a lot of emerging research on the correlation or connection between learning and health, there are more and more people willing to listen to the health imperative and what those opportunities are. And we kind of bring that stuff to the table. And when it comes to existing school buildings, and we know we have more failing facilities than we do successful facilities, I think we need to, as a collective group, work really hard to create great tools for people to implement change where they are. And that would be teachers, students, parents, not necessarily facilities, superintendents, et cetera. Everything works together, but I've noticed that when you can empower people with the right tools that are easy to apply, they're more willing to do them. And sometimes it's just those small acts of change and the storytelling that comes with that success that kind of spreads the positive impact for people to, keep the momentum going for change, because it's not always going to be supported from the top down, if that was an answer.
Yeah, so I'm going to poke a stick at our two middle panelists over there for a second. I'm going to take that and poke a stick and say, so how about this? So question. So when we put up a new building, we have something called an owner's project requirements. The owner's project requirements, as both of you guys have alluded to, speak to what matters to the team. They, along with the basis of the design, they provide the basis for commissioning and understanding whether you've gotten the building and the building is operating as you designed it. Seems like we don't have any OPR for health. Why not? What stops your design team? What stops the teams you guys are on from writing an OPR for health? Why can't we commission that stuff?
Well, I think it's the same thing, why you don't have an OPR for, beauty. You don't have an OPR for a whole bunch of other things. I mean, there comes a point in time when it says it should just be the way it is. I think one of the real challenges that we have is if you, in traditional study of architecture, many of these things are not brought in. How do we design for health, right? What are those things, what are those questions that we need to be asking during the design process, during our formatation process to address that? And then we should just be doing it. It's, you do it, and then if you have the issue of the value engineered, well, there's tons of data out there to say, hey, this is why we're doing it. It will continue to support the argument, and then you're going to have to fight for it. But as much as you're fighting for wanting to have that marble coming in from, Italy, you can equally be fighting for, we want to have, operable windows, or we want to be having, low-emitting materials, or we want to be having, colors, we want to build sensory environments. But part of it is really the education of the whole, it's the designers, it's the contractors, it is in many cases also the owner, but they are hiring us because of our expertise. They are hiring us to bring that information to them. They have a performer, they say, yeah, we have this many square feet and we have to put this many people in there, but we have a lot of leeway on how you do that. So, the concerns about stairways and atriums, I showed the picture of our LA office, had the big staircase in it. That space is designed for 125 square feet per person. It's dense, but you can still put in those things. It's just, knowing how to do it. So the challenge in many cases is on to kind of the architects to just do it.
Well, I would disagree. I think architects have their hands tied many times. A lot of these features, they wind up being good long-term values and very bad. They're high first cost, good long-term values. And a perfect example is a green roof. People say green roofs don't cost anymore. In the long term, that's probably true. Over 20 years, a green roof might save you money, but your outlay for a green roof is a lot more than a regular roof, conventional roof. So I think the key is you have to have the institutions start looking at long-term value versus short-term value. And if all you're looking at is first-time cost, you're going to wind up with a whole lot of vinyl and a whole lot of small spaces.
All right, well, that provokes some questions, some hands. Let's follow those.
Okay, all the federal agencies are supposed to use life cycle costing and planning out. Now, I don't believe, I believe they fudge it a little bit, but the life cycle cost should take care of this. Now, why, Steve, isn't it getting at that problem? Is the balancing that first-time cost with the life cycle?
Well, I think maybe some people could speak to this better than I can, but I think that's what federal entities are supposed to do, but I don't believe that's what they do. If you have a building, the building is authorized. There's a certain amount. There's a construction value, a construction budget for this building. There's an operating budget. They're completely separate. They can use, now in the perfect world, you would use some of that operating budget to build the building and then save money in the long run, but that's not the way it works. You can't go one penny over that construction budget. So in theory, it makes a lot of sense, but in practice, you're limited to the construction budget. You can't go a penny over. And when you look at your program of requirements, you've got to build a building that's so big for this budget, your hands are tied of what you put into it. And as much as you want to put in that big communicating stair and that big atrium, those nice materials, chances are you can't afford it.
Sorry. Can I just?
Yeah, please.
Yeah, so just one of the things, right? So when it comes to life cycle costing, I think we actually have the methodologies that we can use to say, like for energy efficiency, because there's a dollar associated with the paying of energy, and there's a dollar associated with how much I'm paying for water. What we haven't done, or what isn't there really, is incorporating that improved productivity or better health and what that means to offsetting the cost of an operable window. So that is an area that we definitely need to be working on from a life cycle costing perspective. It's coming. Autodesk is actually working on a product right now, AutoCase, where they're starting to play with that and starting to fold in that data. And I think the other issue that we have, not so much the owner-operated actually has, I think, more flexibility when you have, commercial in the commercial building sector where you have a developer building the building or owning the building separate from the tenant. It even becomes a little bit more complex because the benefits that like energy efficiency or better health doesn't actually translate to the developer unless they can figure out a way to monetize it. It translates to the tenant, and I think that's one of the things that we have to figure out, better financing mechanisms that bridge that gap. And so that we don't have, in essence, we're fighting against one another for really developing a good quality product.
So let me actually take the liberty of adding one injection to that. So one thing that we have known, so last year we did a study for the Department of Defense that participated in the study for the Department of Defense, and we used the OMB cost guides to look at the return, the cost effectiveness of green building for DOD. And I'll give you an example of where this comes together, and I think many of you guys are aware of this, but some of you guys, when we look at the life cycle cost basis on OMB criteria for DOD use of green building, they value two things: reduced water, and reduced energy. On a 40-year basis, 2% cost of money recurring. there is no human benefit. So I don't know what the right number is, but I do know that in the OMB formula, the answer is 0. So one could fix that using some number other than 0. But that's an example. So when we talk about how that is actually done today, that's how it's done today. So, I'm sorry, go ahead, next.
I have a question rather than an answer. I'm used to working with schools from the perspective of promoting physical activity for the kids in order to generate better academic performance, better behavior, and better attendance. And all the schools that I've dealt with are very, very focused on attendance. They're public schools, they're funded by capitation. Why doesn't the decreasing asthma, creating healthy student population, creating more money for the school, why doesn't that translate into a plan for having healthier schools? Puzzles, it's a puzzle to me.
Yes, it's a puzzle. I agree with you. One of the things that wasn't brought out here is there's been a great movement in healthcare without harm for healthy hospitals and design standards and so forth, which has been great because hospitals are science-driven and health-driven. Schools are not science-driven, they are not health-driven. And the national studies on leadership turnover, the decision makers, is the contracts typically run about, people exit their contracts after 3 or 4 years. So there's not a lot of consistency at the top. So that's a problem. I can't explain some of it except that facilities are perceived to be much too expensive. It's not necessarily true. If you're taking care of a building, it tends to be a good asset for a long time.
Hi, my name is Jana Choi. I come from the School of Public Health at the University at Albany. I'm going to speak from a scientist perspective. I've been trying to study the indoor air pollution within schools and the risks of asthma within the school environment. I faced layer after layers of resistance and barriers to conducting epidemiological investigations within the U.S. Public schools. So as a result, I take most of my research projects overseas to Europe, where it's much more amenable to research studies. And so I say this with a bit of frustration that U.S. Taxpayers' funds are going overseas to do studies in the European population. I mean, much of these, hopefully, the findings will be translatable across the countries, but I have come here with a bit of a hope that maybe we could put our heads together and see how we could, get over this disconnect and help me to do my job within the U.S. population.
Yeah, I just want to follow up a little bit on the European comment. It is, to me, so interesting because they've done a lot of research. They know a lot of stuff. I mean, the idea, like building a new building, we should make it skinny so you can have good daylight coming in, right? We know this, and yet we continue to fight that and say, no, we have to do the research on our own. And there's so much wonderful information available, particularly from Europe, but from other parts of the world. Let's leverage that and apply it rather than saying, we got to do it on our own. It's like, so just.
One of the issues that you have working the research in the schools that I've run into is they're all liability afraid. And until we can get that under control or be able to make the U.S. schools understand better, and if you talk to them enough, eventually you can get into them. But it's overcoming the resistance and assuring them that everything will be blinded. There is no way anyone will ever be able to tell which school you were in. And the other fear that I run into is, because we did a big study for DOE of comparison schools, and the schools were side by side in it was in multiple cities, and they were purposely side by side. Well, then the fear was, what if anybody ever figures out which is the better school? Because my child is right across the street in the worst school, and I want my child in the best school. So until we solve this problem, the fear problem, it's going to be almost impossible to work in the schools in the U.S.
Hi, Chris Long from NIH, from the Environmental Health Institute, where the other Chris is from. Everybody there is named Chris. And formerly 22 years at EPA, working with Lorna and other wonderful people. My thought is this is kind of accumulated thinking for a long time, since the early 90s when I started working on green buildings, when we didn't even know what that meant. And we felt like a bunch of us kind of made up this word sustainability that stuck around. But what I've seen is that environmental, the EHS, Claire mentioned EHS and it sort of blew right by for a lot of people, but environment, health, and safety groups exist in lots of places, like school systems, on college campuses. So environment, health, and safety are kind of integrated, at least organizationally, a lot of places. I know our environment director, Kenny, is here, and this health discussion is taking place on his watch. Translation, to me, a lot of times comes down to the fact that a lot of really smart scientists are working on a lot of these questions. And if like me, you've been in scientific presentations for many, many years. I'm not a scientist, but the last slide is always more research is needed. And 20 years ago at EPA, we were trying to figure out how to build the North Carolina campus that's there now. Had no idea, but there are all these scientists around at EPA, and there were some over at NIH, and we got scientists in a room, and a lot of them would not tell us what to do. They would just tell us what the indications were, and we're doing more science in this area, and so give me an answer, let me move forward. What I'm finding is the environment, health, and safety, the EHS community out there is pretty good in many cases at working that translator function. You know, imagine the UN if we didn't have the translators working, or they translated wrong, we bombed each other. So there's a translation need there. Architects and engineers and scientists are all doing lots of stuff, but on the owner side, somebody's got to say, okay, is this stuff, are they feeding us a bunch of junk here? I mean, is it really going to help with reduced absenteeism or prevention of workplace illnesses and things like that? So I would encourage you to look at the EHS community as, trying to draw them more into this and get them squarely involved in this and look at them as translators.
This is great. Actually, let me, in the interest of our time, let me do that. I'm going to make a suggestion, and you guys can blow this off actually if you want to. But I'd like to spring off that question. I think we've obviously spiraled down to a bit of a dark moment in thinking, oh my God, it feels a little dark. So let's actually take that question in two different directions. I would love to go down the panel and ask you, what do you? I'll start with myself actually, but what I suggest is, what is the primary barrier because the title of this session is Decision Making That Promotes Health. So I'd like to know from your perspective, what is the greatest barrier to the promotion of health, and what is the single most effective intervention we could make? Single. So keep yourself to one concept, one barrier, one solution. And I'm going to express, let me kick this off with an example. For me, it kills me on health that there is a profound mismatch between our intention, this statement that was made earlier, architects go to school to promote health or promote healthy buildings. Take a drive off of 95 in any direction, and you will see a landscape that clearly was not designed to promote health. So the emergent phenomenon of what we have done with the built environment is directly at odds with the notion that somehow the built environment professions generally are all on the same page with this issue. And so for me, I want to know where that breaks down. And for me, I think that when it comes to one instance of schools, I want to be able to go to a school and know what is healthy or not healthy about it. I have as a parent and as a professional, a complete absence of information. So I have a market failure. I can't begin to act until I have comparable information on this quality, and I don't buy that everyone needs to bottle it up for some liability reason. I buy Cheerios, and they put the ingredients on the side, right? So, and I wouldn't buy Cheerios if they didn't. So, okay, so that's for me. My barrier is I hate this disconnect between our value to create healthier places and my complete absence of information on the relative health of the places I am compelled by law to send my kids. That sucks. So anyway, that's mine. So next. Come on, there's a pessimistic and an optimistic part to this.
So one of my things is as we can tell, there's a lot of great research out here. And yes, everybody says we want more research, but sometimes you just got to act. You just got to do. And I think that's my call to all of you is just in your own respective spaces, start to just do. And like if you're a researcher and you're working on things, yes, I know you want to have stuff printed out in an academic journal and want it peer reviewed, but there are little tidbits that you can be posting out on Facebook, or you can be tweeting about, oh, you might want to check this out, getting the information out. We have to speed up. I mean, on the design side, on the construction side, our time schedules are incredibly compressed. As academics, you have to realize that that's what the world is coming to, and your time schedules are going to be compressed. We do not have 7 years for you to go and research something. We don't. And so, the pace, I think that my ask of everybody is we need to speed up the pace of getting information out and just act. Take something, a pilot that you put on every single one of your projects, every single intervention on each one of them, and then get that information out.
I think to answer the question, so my presentation was about stumbling blocks, which was too bad because it's kind of a pessimistic approach. But looking at it from an optimistic approach, I've been in the profession long enough that I remember when all this green building stuff was considered, frou-frou, and no one really wanted to put up the upfront money to obtain the long-term benefits. And now it's pretty standard. Now you'll have everything from schools to office buildings to universities saying, yeah, I'm willing to pay that extra 5% up front, realizing, number one, it's the right thing to do. Number two, I'll probably recoup that in the life of the building. And I see slowly, but hopefully more and more, some of these healthy aspects that we're talking about are going to be approached the same way. And I think the people who are in charge of the budgets and the programs will start seeing the benefit of adding that extra, whatever the percentage is, to get those long-term benefits. So I don't think we're there yet, and I think we're doing the right thing to talk about it. But I'm optimistic that soon it'll be like green buildings. It'll be an accepted part of the process.
So we had a couple of very interesting conversations here. One which Charlene led off and said, there's a really positive example here of walking in the door and creating something which is really exciting. And another person raised the question, I can't get in the door to do even the basic research. And we have high turnovers. I think that when the states are leading, they're leading because they have good examples on the ground they want to expand and extend statewide. And so I think building more good models and making sure that if you do that, you connect to the NGO advocacy community who wants to see it as a statewide policy. That you can build good models, but just because you have one doesn't mean you go and do only one forever and ever and ever and ever over and over again. So at some point, you need to change the system. And we really have focused on systematic change. So we look at big measures. Who's measuring kids? Nobody. Who's measuring buildings? Lots of people, but they don't implement it and apply it consistently. So.
I think somebody talked about translation, and if it was the UN, Chris did, and if it was the UN and we didn't have translators, we wouldn't be able to have, Chris Long, you might have said it too. We wouldn't have the ability to make good decisions because the right information wouldn't be getting out there. I think we have a translation issue. I think what we talk about here, if you take this conversation on the ground to building owners, to maybe some designers, but certainly building owners and people with the financial purse strings, like Steve said, they don't think about their world in this way. This is not a part of their conversation. So the more we're able to translate what this conversation is to the people that are designing and operating buildings is critical. The other thing I think that needs to happen is also what's been said before, but better storytelling. I think we need to hire Madison Avenue. We got smart people out there who can sell you the weirdest stuff on television. Why can't we sell this? What's wrong with us? Are we, is it science speak that people don't want to hear? Is it government speak that people don't want to hear? Let's go to Madison Avenue. Let's see what they have to say. Why isn't the health of children foremost? There was a show in 2010 that Sanjay Gupta did on CNN about toxic schools. You can Google it. And, There's a superintendent said, I wouldn't send my kid to these schools that I'm sitting in because they're bad, they're unhealthy, we have rain coming down. Well, what happened to that? Why didn't that stick anywhere? Why are poor kids still living in lousy, unsafe, scary buildings? Not green, miserable. Why? Where's the stickiness? Are we not speaking right? Or we don't have the right marketing? So.
What?
Charlene, you haven't gone yet.
I'm going. I had thought and then I went out of my head. To me, I think that the biggest barrier is lack of understanding. Going along what Lorna said, I'm watching a news story in Atlanta lately about mold growing in a school, and they brought in some industrial hygienists, and they said, oh, this isn't so bad. The kids are fine. And I'm like, wait a minute. And it's lack of education. I mean, it really is lack of their understanding, and I think that's a huge barrier. But on the upside, we're here. Charles and I started talking 4 years ago, and getting the whole attitude started, and it was kind of like, yeah, you want to do what? And we're here. So I think that among the community that there's better understanding, but now what we need to do is be much better at translating what we're hearing, which walks us into the next thing. And you're right. I mean, and in academics we're slow. You want to prove it and prove it and prove it. I've got so much data I've never published and I've never shared. And listening to you, I'm like, why? I mean, it's really stupid. I mean, some of this stuff I've sat on for 10 years. It should be out there. So I think education and moving that along is the most exciting thing that I think we can do.
All right, I like this. So I knew we could get you guys riled up eventually. Thank you guys for playing along. So, all right, one last question from Jim. Actually, and then we're going to have to move. Then we're going to give you a break. So hold on 1 second.
Thank you. Great. Another extraordinary panel. Thank you so very much. I think as we're leading to wrap up the roar session and so forth, I really do think that at least a large part of the solution is being identified in the discussions. Like there's an acting Surgeon General who is a phenomenal supporter for this, historically supportive of this. So you've got all these different pieces in place. But there isn't, like if somebody went, well, what's our plan to change the country and the culture and to establish a social movement and to drive it? We're not quite there yet. This conference is part of assembling that. But so one of the things that, spoiler alert, that I'm going to say in the roar session is we need to devise, really, a very inclusive, very hard-hitting plan that models off of other things that have successfully driven change in this country and around the world. And look forward to doing that with all of you.
Awesome. So actually, since you brought up the Surgeon General, I'll give you just one 30-second story, and then we'll go to the break. So, and Whitney was in the room at the end. We had the Surgeon General at Greenbuild, and he's been making the rounds for the built environment thing. And I want to convey one last thing that the acting Surgeon General said to you is everything you described. He's fantastic. He's really insightful. And, he left Greenbuild, and when he came to Greenbuild, he actually said this himself. He said, I thought I was coming here to kind of give you the word from public health and tell you that what you did mattered. And then he met a bunch of the people at Greenbuild, and he met a bunch of people at AIA and APA and so forth. And he was like, wow, he had to reconsider, and he said he really had to kind of rub his head and go, maybe you guys are out in front of us, and maybe we need to catch up with you or go down this road together. And that actually, to Charlene's point, that is a massive step forward. And actually, Whitney and Matt Trowbridge were in the front row as he was kind of doing this thing, and that was a pretty cool moment. And so if that's where we can get to, that we actually are going down this road together with the public health community and the design we can pat ourselves on the back. All right, let's take a coffee break, back in 10 minutes, 12 minutes, and one last panel.